Your tips are, this is clean, this is dirty. There you go, all the way down. Off we go into the trash. Very nice.
Today we're here for the first day of the 2-day boot camp. We have our new residents who are joining our surgical programs, both in general surgery, neurosurgery, obstetrics, gynecology, and our podiatry program.
At a lot of other places, there are very specialty-specific boot camps, but I think what's special about ours is we've brought all of the procedural residents together. It's a great way for them to meet all of us as faculty. It's a great way for them to see us modeling how we work as teams. And interpersonal relationships are really important when you're taking care of people at night or during the day in the hospital.
Hi, I'm Luke Muggy. I'm the neurosurgery intern, and I'm from Toledo, Ohio.
I am Colleen Kelly, coming from Georgetown, Bethesda, Maryland.
I am Mira. I come from Philly, and now I'm an OBGYN resident here.
I'm Lan Abernathy. I'm a podiatry intern from Western University of Health Sciences in Pomona, California.
The goal of our bootcamp curriculum is to enable our interns to feel both confident and competent so that they can hit the ground running on day one of residency.
Everything from how to gown and glove in an operating room, how to consent to patients, to what they're going to experience in their first nights on call with different clinical problems that they'll see with patients. And we finish up with a Team Steps program that teaches the culture of safety in a teams-based approach.
Your first year transitioning from medical school to internship, there's a great deal more responsibility. And the residents like to have this opportunity to see how to do things, ask questions before the pressure of actually caring for patients takes place.
What we've done here is we've taken interns and put them into scenarios, and in every single scenario we have an embedded nurse participant. And the nurse communicates with the intern much as they would the first night on call. We have 7 simulation stations here. We have 18 interns, 8 faculty, 7 nurses, 5 sim techs, and an Epic trainer, as well as all of our wonderful actors, our standardized patients, and our embedded nurse participants in every single room.
Morale high five. Morale high five.
I feel 100% better than I did before. I think these simulations helped, and just having the attendings here backing us up and reassuring us really gave me a lot more confidence than I had coming into it.
As a general surgery intern, the boot camp was a great way for me to get my butterflies and nerves out of the way prior to going on the wards, now that I'm the one to give the orders and really decide what's wrong with the patient.
A very important part of patient care is being able to work with all members of that team, whether it's the ultrasound technician, the nurse, the lab tech, and all the ancillary staff that really provide excellent patient care. So one of the great benefits of this program is that our interns do get that exposure working in these huge interprofessional teams from different departments even, and so they're used to those sorts of communications when they start their residency.
It was with surgery and neurosurgery and podiatry, so it was a good way to see how every other kind of standardized care amongst the different surgical subspecialties. And then to all the nurses and the standardized patients here, which the standardized patients are excellent, give great feedback. It's way more insightful than I've ever experienced.
So there's a lot of aspects of neurosurgical care that crosses over with trauma and ICU and the neuro ICU, and there's a lot of those topics were covered very well today. Things of how to manage things post-operatively and how to prepare patients to progress with care effectively so that we can get them discharged and ultimately provide better care.
At Inova, we have a very specific culture in our operating room. We're very patient-focused, we're very safety-focused, and we've been working really hard at this institution to promote communication and respect between all of our team members. So I think that this boot camp is a great way to introduce our incoming residents to the operating room culture at Inova.